Yes, we are recording another video. So, what's the subject?
Well, this is not that clear, but essentially what we're recording is how do you find a designated prescribing practitioner in London?
It's the hardest one. Is it?
Absolutely. It is challenging, but it has its advantages as well. So first of all, folks, what is a DPP? Essentially, it stands for Designated Prescribing Practitioner. And prior to this word, we used to have another acronym, and that was called the DMP, Designated Medical Practitioner. And before the law changed, and we'll discuss what the job and role of this particular title is, but the only individual that could act as someone who could supervise a healthcare professional to help them gain their prescribing qualification. So let's explain again. This DPP, DMP, what is it? If you're a pharmacist, if you're a nurse, or you're an allied healthcare professional, for example, a podiatrist, physio, so on, and you want to gain your prescribing qualification, then you need a couple of things. Number one, you need to be making sure that you can meet the requirements of your regulatory body. So for pharmacists, it's the General Pharmaceutical Society, the GPHC. For nurses, it's the NMC. And for allied healthcare professionals, you will have your own regulatory body. And essentially what they say is you need to be on the register. You need to be qualified for a certain number of time period. So we can put a bit of a clock here. So it's not the best clock, but we have a clock there. You then need to also have a scope of practice. And folks, I've done plenty of videos explaining to you what is a scope of practice, how to find the scope of practice. And then what you need is someone, and in some cases like a nurse, two individuals who can supervise you and ensure that you meet the requirements of the university. This supervisor is called a designated prescribing practitioner. Nurses may also know it as a practice assessor. So it's the same thing. And that's what we're talking about, is how do we find this individual? And how do we specifically find it in London? And that's why I was explaining to you that prior to this term, we had another terminology, and that was called a DMP, where this particular role could only be fulfilled by a doctor or a nurse. A doctor, not a nurse, a doctor or a dentist. And I hope this pen can be removed, because Farouk is not going to be too happy about this. But a doctor or a dentist. But now, anybody who is qualified as a prescriber, not anybody, but a pharmacist, a nurse, a doctor, a dentist, who's been qualified as a prescriber for more than 3 years and has training or competency within the area that this individual wants to gain their prescribing qualification. They have access to patients. They have teaching experience. Then they can act as a DPP. That's the point. So when you're looking to find somebody in London, first of all, ask yourself, have they been qualified for long enough? Do they have experience in teaching? Are they going to be able to support me on this journey? Because I'm telling you folks, just going and paying companies to match somebody up like a marriage bureau, it doesn't work. You'll find someone who's willing to do it, and it might even be cheap as chips. But ask yourself, am I getting the training that I need? Am I going to have the support network? Will they support me while I'm on the course, during and after I qualify? Or am I just paying someone just to essentially, and this is not the case, that this is what happens, to sign me off? So there's a lot to think about. So when you are looking for a DPP, I would say one, do they have experience? So first, experience. Specifically, do they have experience in my area? Have they taught pharmacists before, if you're a pharmacist? Have they taught nurses before? Have they taught, for example, a physiotherapist before? 2, do they have training and competency within my scope of practice? 3, how are they going to support me? Will it be handheld? So will it be an active relationship? or will it be passive? So make sure there's a contract in place. That how are you going to help me? Are you going to teach me how I take a history, how I examine? Are you going to help me put my skills into practice? Will I be able to observe and then undertake consultations? Or will it just be a case of you're just observing, nothing else? That's the things that you've got to be able to answer. Then, once you have that in place, where you say, look, it's the right person, so he has experience. He's agreed to support me while I'm on the course and after I qualify. He's been involved with various universities, so understands the requirements. For example, OSCEs, paperwork, witness statements, and so on. All of that he understands. He understands how to case-based discussions and so on. This is the right person for me. Then how do we find somebody in London? Step one, think about LinkedIn. Why don't you go into LinkedIn or go to Sales Navigator? Have a look at the filter options and perhaps type in Doctor in London. Send them a message. Introduce yourself. Explain exactly what's required. Think about setting up a meeting. Do that first. If that doesn't work, why don't you think about getting in touch with fellow pharmacists or whatever your profession is to ask who have they used in the past? Do they have recommendations? Going on Google, typing in find a DMP, and you'll find various organizations that do it. We can certainly help you. And there's other organizations. But make sure that you have that initial consultation. Then think about, which I don't think is the best way, is actually getting in touch with individual surgeries. Again, even when you get in touch with individual surgeries, think about what is in it for them. And it's not just about the money, let me tell you that now. It's a big responsibility and it requires a lot of work. So make sure you have an email or something drafted of what's required, what support you need, and so on. And now with the technology that's available, for example, ChatGPT, Claude, all of this can be done for you. And if you're still unsure, folks, get in touch. But a quick recap, what is a DPP? It's someone who needs to supervise you to make sure that you are competent in your prescribing. That's straightforward. Who can act as a DPP? Can be a pharmacist, can be a nurse, can be a doctor, can be a pharmacist, nurse, doctor, dentist, so on. Do they have the skills that I require? Have they been qualified for 3 years? Are they actively prescribing? Have they got relationship with universities? Have they done relevant training to know what it's like to act as a DPP? Have they supervised your profession before? Are they going to support me while I'm on the course and after I qualify? Or just not really, just that's it? What will I be doing? What sort of task will I be doing? But in order to understand this, you've got to understand what's required in the prescribing course. You can't approach a DPP and say, right, act as a DPP. They're going to ask you what's required. And if you don't know yourself, you're going to get in a problem. Once you've done all of that, then where do I find them? Number one, don't pay anybody. Go to LinkedIn, go to Sales Navigator, be proactive. Number two, get in touch with us at MedLearn. There's various other organizations, get in touch with them. Number three, think about any friends, family, any connections that you have in your circle that used someone before. And I think it's number four now, or number five. Think about the good old fashioned sending emails to surgeries, but not the best way, because it's just, you don't have a relationship, you're cold calling, it's going to be tricky. Even more important, start to use tools like ChatGPT and Claude to help you write out a message. And if you're still unsure, folks, get in touch with us at MedLearn. We are more than happy to help. Always subscribe, like, and share. And that's how you find a DPP in London. It's not rocket science. You've just got to be proactive. Thank you for watching.